Thomas Embling operates under a complex legislative framework that governs the services provided by Thomas Embling and protects the rights of patients and clients. The key legislation that covers treatment of people with mental illness is the Mental Health Act 2014. This act provides a legislative scheme for the assessment and treatment of people with mental illness. The new act sets out frameworks to promote recovery-oriented practice and further protects the rights of people living with mental illness. This includes ensuring that people with mental illness have the right to be involved in decisions about their assessment, treatment and recovery, and for these decisions to be respected. It ensures that individual needs such as culture, language, communication, disability, and other characteristics are recognised and appropriately responded to. In regards to the recovery framework, the Mental Health Act ensures that all treatment encompasses notions of self-determination, self-management, personal growth, empowerment, choice, and social engagement. In regards to Thomas Embling, the Mental Health Act has policies in place to ensure that the institution provides not only clinical assessments and inpatient forensic mental health services, but states that they must also provide community education, which is reflected in Thomas Embling's services, which will be discussed later. Another important legislation to mention is the Corrections Act 1986, which has put in place policies within Thomas Embling, ensuring that all patients are outside in the open air for at least 1 hour every day, and that patients with specific dietary requirements due to medical reasons, religious beliefs, or being vegetarian receive the appropriate food. Thomas Embling also has many internal policies that ensure the organisation is running effectively and safely for all staff and patients. These policies include ensuring contraband items are not brought on site, policies surrounding how patients progress through the system, policies surrounding community leave, which will be discussed later, and a non-smoking policy, which was put in place to reduce health risks on the consumers, families, staff, and visitors. So Thomas Embling also provides many services in order to treat and rehabilitate patients, whilst also providing them with the skills and knowledge to return to daily life outside of the treatment facility. The acute care program delivers individual and group therapy during the acute phase of a mental illness. The program involves the use of a comprehensive multidisciplinary biopsychosocial assessment. The acute care program comprises of 60 beds in 4 different units, with 50 of the beds reserved for males in need of acute treatment. Only 10 beds are provided for women in need of acute care. Thomas Embling also has a continuing care program, which assists patients in gaining and maintaining an optimal level of independence. Collaborative decision-making facilitates the recognition of existing skills and helps create opportunities for patients to grow and develop. Whilst this program works with patients to reintegrating into the community, it also works with people who require long-term care due to their chronic mental illness or due to presenting behaviours that are considered a risk to the community. In patients who are progressing through the system towards recovery, the community leave program comes into place. It enables patients who have been granted leave from the forensic leave panel to access activities such as employment, grocery shopping, attending medical appointments, consensual visits with families, and other activities. This process is taken slowly, with patients first getting more grounds privileges within the institution to 2-person supervised leave outside of the institution, then 1-person supervised leave, and finally unsupervised daily leave. Physical exercise is also an important part of the recovery phase from mental illness. So Thomas Embling has developed a health and wellbeing program that provides patients and staff access to an indoor swimming pool, sports hall, and cardio and strength rooms. And finally, Thomas Embling works in partnership with Kangan Institute to provide training for patients. The Institute offers a range of courses including building and construction, business studies, furniture making, education, horticulture, hospitality, visual arts, and more. This provides patients the ability to become active working members of society upon their release from Thomas Embling Hospital.